Hi, thank you for watching the channel and thank you for all your comments. In this video, I'm going to be specifically looking at one of the comments that's come from you asking about the role of tender points in fibromyalgia and where the location of these tender points would be. Now, many of you in the medical community would be aware that up until 2016, the way to diagnose fibromyalgia was supposed to be a set of 19 tender points, areas specifically in different parts of the body that if you pressed with your thumbs and if the patient reported pain, then those would be added up, and if patients had 11 or more out of the 19 points tender, then that was all that was required to make a diagnosis of fibromyalgia. But in 2016, the American College of Rheumatology came out with a diagnostic criteria because they realized a couple of things. One is that over 20 years of having this kind of tender point way of finding the particular areas that are painful, that wasn't working. Partly because there was no consensus on how hard you had to press in these areas, and different people responded very differently. And over the years, there were some suggestions that if you pressed with your thumb until your nails blanched, then that's the amount of force that you need to do. And this was difficult to really validate, to standardize, and indeed, even among rheumatologists themselves, there wasn't any consensus or uniformity. So effectively, in 2016, the American College of Rheumatology took note of all these challenges and decided that with the better understanding of fibromyalgia, we needed to upgrade the whole classification and diagnostic system. From then on, tender points really aren't used as a way of diagnosing, and I think anyone who still uses that is being outdated and using something that doesn't sit with scientific evidence. The better way now is to really accept that fibromyalgia has got a neuroimmune dysfunction problem, and that means that there is a signal processing challenge with the condition, and therefore there are many other symptoms rather than just pain and tender points. So we've got two parts here, which is the widespread pain index, wherein you're only looking at the areas of the body that are tender, and there are 5 regions that have been sort of divided into. You've got the upper back, the lower back, the upper limbs, both your upper limbs, both your lower limbs, and the front of the chest. So these are the 5 regions of the body. And then within each of these regions, you go through a particular set of an area that's tender. So whether on the right side, you've got the right jaw, or you've got the right upper arm, or the right sort of arm between the elbow and the wrist. And similarly, in the leg as well, you've got the area of the thigh or the calf. All of this has changed the way we diagnose it. So the widespread pain index is then combined with another scale called the symptom severity scale, which looks at the kind of symptoms that people may have, which are characteristically brain fog or concentration problems, memory issues, and sleep. And combining these, you get a scale, and that is what is now used to diagnose fibromyalgia. So the tender point way of classifying and making a diagnosis of fibromyalgia is outdated. What we must be looking for and using is a combination of the widespread pain index and the symptom severity scale. I hope this was useful for you, and I hope it gives you a better understanding of the complexity of a condition like fibromyalgia. Thank you for watching, and I look forward to seeing you in the next video. Thank you for watching the videos. I hope you're getting value from them. Don't forget to subscribe and hit the bell button for notifications on when the next videos are to be released.